And of course, thank you all for staying up late with us here on The Factor Uncensored. We have some great segments for you tonight and guests. Now, welcome to The Factor Uncensored. We begin tonight with a sensitive and important topic that has become even more critical after the overturning of Roe v. Wade back in 2022. The Supreme Court decision left the abortion in the hands of the states where procedures were restricted. Now, a new study says the alternative to in-person abortion is via telehealth and a drug that can induce an abortion. Dr. Danish Ali with Archpoint Pain Institute joins us to discuss the pros and cons of obtaining abortion medication through a telehealth appointment. Dr. Ali, interesting study recently out indicating that medical abortions can be done and are safe and just as good as an in-person visit to a doctor using telehealth. Explain that to us.
Yeah, Isaiah. So recent studies show that folks that are visiting physicians, maybe even OB-GYNs, primary care doctors, and getting medications for abortion, the medications and the visit to a virtual visit, a telehealth visit, is just as effective. And that's what this research shows. And so there's a medication out there that in different states, you're able to get that medication prescribed depending on how far you are along in the pregnancy. Here in the state of Texas, it's generally 6 weeks, unless you have other complications, such as an abortion, such as a miscarriage. And you may have to take it at a different period of time. But generally speaking, it's 6 weeks here in Texas that you can take it from your last menstrual cycle. And this is a medication that can be prescribed by a physician for somebody who wants to get an abortion up until about 6 weeks. This is different, Isaiah, than the Plan B medication that's now available over the counter here in the state of Texas. And so we want to make sure that that's clear. Plan B is not effective if you are pregnant versus the mifepristone, which is also effective in case you are pregnant, and you can get that prescribed up to 10 weeks or 6 weeks here in Texas after your last menstrual cycle.
And Dr. Ali, when you say Plan B, many of us know that as a more popular drug. People call it the morning after pill, right?
That's correct. There's different versions of it, different manufacturers of it, but generally the concept is very similar in the sense that it prevents ovulation, whereas the mifepristone actually binds to the progesterone and makes it from stop working, which that's what's necessary. Progesterone is necessary in order to continue the pregnancy. So it's two different medications and they work differently, and one is not effective at different periods of time.
Now, we have known abortions to be a one-day visit, in and out at the doctor's office. But do you subscribe to this, that it would be good through medication and a telehealth visit? Do you trust that as a doctor yourself?
Yeah, Isaiah, it's a good question. So generally speaking, it depends on where you are in the pregnancy, number one. And number two, it's more important to know what are your other health risk factors as well. Number three, it's still very important to talk to your primary doctor or even to your OB-GYN because, some of these medications may not be indicated if you do have some medical comorbidities. Or if you have a history of ectopic pregnancy, which is where the uterus and the ovaries where you get pregnant in the past may not be in the right spot and maybe not indicative or a reason for why you need to take this medication. So it's really important still to talk to your primary doctor or to your OB-GYN about this and see, is this medication the right treatment for me, depending on how far along I am and how many comorbidities or other medical conditions I may have.
Now, even though, say, we're in the state of Texas, our limit is still 6 weeks. Some other place in a different state, their limit may be higher, their limit may be lower. So wherever you live, you have to follow that rule. Only up until 6 weeks can you get that medication to induce an abortion.
That is correct, Isaiah, and that's why this stuff was very controversial when it came out because number one, it changed the ruling on some things, and every state was deciding on how long they wanted to issue this medication till. And number two, some folks were then leaving the state to go get a medical abortion in another state, perhaps that had different rulings, and so that's why it's been under lots of scrutiny and discussion and controversy. And that's why it's so important to talk to your physician here, especially if you are planning on becoming pregnant or if you have risk factors, because the treatment may vary according to that.
And of course, we know the battle between pro-choice and pro-life out there, Dr. Ali. And I hate to use this term, but if you use telehealth and you do it from the convenience of your home, that's the word I hate using when we talk about abortion, convenience. But if you're trying to avoid, say, those protesters who may be out in front of a Planned Parenthood or a gynecologist's office that may be doing these abortions, then you don't have to go into that crowd, or you don't have to show the public who you are just by walking into that building. You can do it through telehealth and medication. And it's my understanding it's the most popular form of abortion right now in this country, right?
That's correct, Isaiah. This medication is a very popular form of medical abortion. Depending on how far you are along, depending on what state you are, there are other surgeries and other procedures that you can get done to induce abortion as well. However, as you said, you're right. I mean, in all reality, the scrutiny, sometimes it may be, talking to and going to a OB-GYN office or primary care doctor that some people may not be comfortable with, and they may feel more comfortable just having a televisit or a virtual visit. And so this opens that opportunity for folks to have that discussion, because the best thing we can do is have that discussion, talk about it, figure out what are the risks and benefits, and make sure that the patient can make the most educated decision for themselves.
And welcome back to The Factor Uncensored. We continue our conversation with Dr. Danish Ali on what some say is a safe way to get abortions using meds. Dr. Ali, this is a carryover from the pandemic, right? Where they say this is just as healthy even though we're out of the pandemic.
That's correct, Isaiah. Yeah, with the pandemic, we realized that telehealth skyrocketed, and similarly, this discussions and these sorts of conversations with primary care doctors, OB-GYNs, all this took increased significantly. And because of that, now all the research that's been done, it's just showing that, yes, this is still effective. And if your primary care or OB-GYN still offers the telehealth visits, that is just as safe for medical abortions, if that's what you're looking for.
All right, Dr. Danish Ali, always appreciate your valuable information. Very touchy issue here, touchy subject, but we appreciate you giving us the latest and an update, sir. Thank you for joining us tonight here on The Factor Uncensored.